The other thing that's really important is to think about what happens when that hay enters the stomach. If we take chaff or pellets or cubes and we chop them up and we mix them with water, we create soup, and that soup is going to splash around. When we take hay and chew it up and the horse swallows it, it still forms that roughage ball. And so the physical structure is as important as the chewing. When we look at this study here, they were looking at horses eating hay and the same amount of calories as pellets. And two things. One is that black on the right is searching behavior. So horses getting pellets, not surprisingly, weren't satisfied, even though they'd been fed their caloric requirement. And so they spent more time searching, and that's a welfare issue. And we underestimate the welfare value of hay as something that horses that are stabled should have access to from a welfare benefit, not just a gastric benefit. In addition to that, when we look at the bottom here, what we're looking at is the number of chews per day. Horses eating pellets chewed 10,000 times a day. Horses eating hay chewed nearly over 43,000 times a day. More than 4 times as much chewing for the same amount of calories for hay than pellets. So we've got a roughage ball, we've got a lot more saliva production, we've got huge welfare benefits. So wherever possible, we should be taking our calories and our nutritional requirements, and alfalfa is great, or lucerne for those of us in Australia, is fantastic for many reasons nutritionally, but our goal primarily is to feed that as hay, not as cubes or pellets, when we're trying to optimize welfare and we're trying to optimize gastric health. There are some benefits I'll talk about later to pellets and cubes, but really it's that management factor that it's convenient for us, but it's actually a backward step for the horse that we need to get our minds past. That's true of many things that we manage. Here's another one, feeding from the ground versus the hay net. So it's easy for us to put hay in the hay net, and we've never really challenged, is that a problem? But we've got some data. Here's a study we did in Denmark last year, and we were getting through and publishing this data. And what we looked at was hay consumption in horses with hay in hay nets versus the same hay in basically a loose environment on the ground or in a feeder. And these were normal hay nets, not slow feeder hay nets. What we saw was that horses with loose hay consumed more than 50% more hay voluntarily, because eating is a behavior and it's a complex behavior, consumed more than 50% more hay than when it was given in a hay net. The horses just didn't want to do any work to get their hay out of the hay net. And that increased or that decreased consumption associated with hay nets was associated with an increased risk of having squamous gastric disease. So it's very management convenient for us to feed out of a hay net, but certainly during the day when we have peak roughage consumption, it may actually be detrimental to the horse from a gastric health perspective, and we may need to rethink that. We can also use hay nets in a different way. We can use them positively. And when we think about gastric disease, we think about the two squamous disease. The peak risk periods are during exercise, and then the other peak risk period primarily is what happens overnight. And so if we look at this on the left-hand side, is what we're looking at is the time budget for a horse overnight from 5 o'clock in the evening through to 6 o'clock the next morning. And what we see is that horses over the bottom is the amount of time spent eating, the top is the amount of time spent resting, and the white in between is just nothing time where the horse is just hanging out. What we see is that horses typically naturally around about 10 o'clock at night fast and dramatically reduce the amount of time they spend eating. And what we have during this 8-hour period is the production of saliva is decreased, the roughage intake's decreased, but the acid is still being produced in horses. They continuously produce acid, and that acid starts to creep up onto the squamous mucosa like a tide in the ocean.